everybody. Welcome back to CoronaChat. It's Caitlin. Today is Thursday, September 3rd, and thank you so much for your patience while we took a little break for some staycation time just to recharge and rejuvenate. It's really, really great to be back here with all of you all, and in the last couple of weeks there's been tons and tons of COVID developments, because of course there have. And so we wanted to do a brief catch-up on some of the kind of biggest headlines that we've seen within these last couple of weeks. And so the first one really has to do with some stuff that probably you've seen actually today, which is about these vaccine developments. So you may have seen some headlines that the CDC, the Centers for Disease Control, is advising states to be ready for vaccine to be available by November 1st. And if you're like us, this might seem a little bit too good to be true, right? And if you're a regular viewer, you know that on CoronaChat we try to have a healthy dose of optimism, but also a healthy dose of skepticism anytime we see kind of a big splashy news announcement. So let's dig into this one a little bit. The backstory is that on August 27th, the CDC director, Dr. Robert Redfield, sent a letter to governors across the country urging states to prepare not just to have a vaccine by late October, but also to fast-track licensing and permits for vaccine distribution sites and really kind of build out all of the infrastructure that would be needed to get a vaccine actually into people very, very quickly. And there's two kind of key takeaways here to note, right? The first is, or I guess two key takeaways when we think about kind of where we might want to take a critical eye and be a little skeptical, right? So the first is that, as we've talked about many times on CoronaChat, vaccines take a lot of time and effort to bring to market, right? So oftentimes vaccines undergo years of rigorous trials to make sure that they're effective and also that they're safe. Remember, we don't want a vaccine that's going to make anybody, sick, and certainly not sicker than the illness it's preventing, right? It can take time to make sure that you do all of the rigorous safety checking to make sure that a vaccine doesn't have any negative side effects. And this is why we need to have strong, robust, very thorough clinical trials. And we've talked about this before, but there's kind of 3 stages of those. And so you need a vaccine to get through, a vaccine candidate to get through all 3 stages, phase 1, phase 2, and phase 3, before we decide that we've got enough data that it is safe and effective and ready for use in the actual public. And although there are a few vaccine candidates for COVID-19 that are now in the 3rd phase of their clinical trials, and that's the phase where you give it to people to test safety and efficacy, a big group of people, right? Those phase 3 trials have only started recently. And so, we may have some questions about whether there will be enough time to get enough data to know that these vaccines really work, provide good coverage, and are, safe. To back any of these candidates up in a meaningful way. But let's say that we do get a candidate vaccine that is kind of approved in late October and sent out to everybody. One of the big questions that many public health people have raised is, well, if we haven't had the time to do as many safety checks as we would like, and it turns out that this vaccine isn't quite as strong as we'd like it to be, or maybe it has some kind of nasty side effects, it could really turn people against the vaccine. We've seen this happen with like the flu vaccine, right, which can typically give kind of limited immunity for so many months, and only works against, a specific strain of the flu as opposed to every flu. And so, people may get the flu vaccine and they get sick later in the season and say, like, well, it didn't work. I'm never getting a flu vaccine again. And for that matter, like, how do I even know that any vaccine works, right? And so we worry about a vaccine that isn't fully ready to go and as close to perfect as we can get it, getting out and, creating some pushback or some negative sentiment. That said, right, again, as we've said many times on the show, we're in the middle of a pandemic. We really need to figure out something quickly. And so if we go in knowing that, okay, this vaccine might not cover me for my whole life. I might need boosters, or, it might have some negative side effects, but that's like I might have some body aches for a couple of days, but that's it. Those kinds of things, if we're very clear with people about kind of the limitations of a vaccine, that can help to prevent people from having some negative backlash. But if we're all just saying like, rah, we have this vaccine, it's going to save everything and we can all go back to normal, if it doesn't work perfectly, we may actually see a lot of anti-vaccine sentiment start to kick up following the rollout of this vaccine candidate. Plus, it can be scary to be the first one to get a vaccine if you don't know that it's safe, right? Most of us would rather say, well, you get it first, and I'll wait and watch and see what happens to you, right? But if too many people refuse to get the vaccine, then we don't get to herd immunity, and it's actually not really very different than what we're living through right now. So for us to have hopes of things getting back to normal, we have to get this vaccine right the first time. So, can we have that by November? Maybe. But, I think the thing that all of us want at this point is to make sure that when we do have this vaccine, that we've done the proper checks to make sure that it's something that's safe, that's effective, and that we know works. And so all of us are going to need to be vigilant and pay attention to not just the headlines that say like, oh, vaccine will be ready, sign up for a testing site, but also kind of what are the checks? Is there evidence to show that this vaccine works? And of course, as we get more updates, we'll be sure to share that information on CoronaChat to kind of go through the data and tell you what we've learned. So the other couple of things that have been going on since we've been gone, as you probably know by now, colleges have been reopening, and many of them have very rapidly been pivoting to be online only. And that's in large part because a lot of these colleges don't necessarily have good ways to test or quarantine students and faculty and staff who test positive, right? It might be difficult to get tests for people, and plus, we know from earlier in the pandemic when we saw what happened in nursing homes, when we saw what happened in prisons, that anywhere where you've got what public health folks are calling a congregate living facility, a place where a lot of people are living together in very close quarters, that this virus, because it's a respiratory virus, right, can spread very, very quickly. And so what we've seen with many colleges that have tried to do in-person opening is that lots of people have gotten infected very quickly, particularly with students living in the dorms. And so we, really need to be able to have a good strategy in place to be able to test, contact trace, and quarantine anybody who's been exposed, isolate those who are affected, right? And make sure that we can kind of contain the community level transmission of the virus on a college campus. So if colleges don't have the infrastructure to do that, it's probably not safe for them to reopen and have lots of students come back. If they do, they'll just follow the same thing that we've been doing here at UNC, that's happened at Notre Dame and other schools across the country, right, of kind of trying to reopen and then pretty quickly having to pivot online with students trying to figure out housing once the dorms close. Do they end up bringing back any illness back to their home communities if they end up moving back home? So there's kind of all of these other things that need to be thought about. And so if you are headed off to college yourself, if somebody in your life is headed off to college, ask about what the university's plans are around making sure that they're able to test, that they can contact trace, and make sure that you get answers that you're satisfied with. Okay, so your piece of good news for this week. This is another thing that came out of the CDC, kind of a surprising thing that happened overnight. The CDC has ordered a moratorium on evictions for any renters nationwide under the Public Health Act, meaning that you can't be evicted by your landlord for not paying your rent if you can't pay it due to COVID. Now, this isn't a total blanket, right? There's a five-part test that you have to pass to qualify, and it doesn't prevent evictions for reasons not related to not paying the rent because of COVID, right? But it does help a lot of Americans who are out of work due to the pandemic and can't quite make those bills. So this is, why is the CDC doing this? Shouldn't this be like HUD or some other group that does housing? The reason that CDC is taking this move is because there's real public health concern that if people are evicted and wind up either in homeless shelters or living in homeless encampments on the streets, that they could get sick and the virus could spread very quickly through a population that's already, at high risk, maybe because they're not eating super well. Lots of folks may have kind of other comorbid conditions. So they may also be older folks who, for whatever reason, have kind of a compromised immune systems, right? We tend to see a lot of those things go hand in hand with folks who are renting and low income, right? Because you don't necessarily have access to the same healthy foods, to the same kinds of doctor's appointments and things like that to be able to keep you healthy, right? And you're super stressed out because, oh my gosh, you just got evicted. So we're seeing the CDC recognize and take action on these things that those of us in public health call the social determinants of health, right? The places we eat, live, work, play, all of this other stuff in our life that affects whether we're going to be healthy. And those of us in public health talk a lot about the social determinants of health, but this is kind of the first time that we're seeing the CDC say, we're invoking the Public Health Act to take an action about evictions because we need to do this to stop the transmission of a dangerous infectious disease, right? So this is something that public health folks have been saying, like, please do this for some time, but we don't really often see public health agencies actually do this. They usually focus more on things like vaccinations or medications, things that are kind of more closely related to the health system. Now, that said, because this is the first time that the CDC is doing this, there's probably going to be some pushback. We may even see legal challenges and lawsuits about this. So will kind of remain to be seen whether this ends up being an effective strategy moving forward. But in terms of kind of really taking a stance to protect people in a time of nationwide crisis, this really seems like an important step. So thanks for tuning in. As always, we'd love to hear your questions, comments, any other feedback. Drop stuff in the comments for us. Let us know what you want to talk about. And in the meantime, stay safe, take care of each other, and remember, we're all in this together.